February marks Cervical Cancer Awareness Month, and joining us to talk about that is Dr. Lindsay West, a gynecologist at Bay State Health. Good morning, Dr. West. Thanks for joining us.
Good morning, Amanda. Thanks for having me.
Thanks. Are there any symptoms of cervical cancer that women should pay attention to?
Well, often cervical cancer doesn't have any symptoms. And so how we will often find it is with abnormal pap smears or seeing a lesion on exam. Every once in a while, there can be symptoms like abnormal spotting, irregular discharge, or in the case of advanced disease, fatigue, weight loss, back pain.
Are there any treatments for cervical cancer?
There are treatments for cervical cancer, which can range from surgery, radiation, chemotherapy, and actually at the end of 2021, there was a new treatment that was approved, so very exciting. But even more important than treatment of cervical cancer would be prevention.
That is exciting. And so how do you protect yourself against cervical cancer?
So to protect yourself against cervical cancer, having regular gynecologic exams, pap smears when they're due, and most importantly, getting the HPV vaccine. So that was approved and in 2018 was extended from ages of 9 to 45 years old. And that is for boys and girls, men and women, and it can prevent a significant amount of disease. 90% effective at preventing long-term HPV infection, which is the biggest risk factor for cervical cancer.
Got it. And how common would you say cervical cancer is?
Cervical cancer, there's approximately 14,000 cases in the United States annually. And of that, about 4,000 women will die of cervical cancer. But at the end of the day, even one case of cervical cancer is one too many because we have a very effective means to prevent it.
Gotcha. Well, thank you so much. That's all we have time for this morning. Thanks for all your helpful tips and advice. We appreciate it.
Great. Thank you.